One of the first patients I saw for Western medicine was a friend of mine who showed up to my apartment late on a weekend because of his complications from top surgery. We dealt with his complications, but this situation highlighted to me that trans people seeking healthcare often have a hard time and receive inadequate care, for example, in my apartment late on a weekend, because they can't find providers that they trust who are not transphobic. And I decided that I wanted to be one of the people that provided care to trans people that was trans-friendly and specific for trans people. I worked at Callan Ward for over 5 years, providing primary care, and during that time I saw thousands of trans patients. And I continue to see trans patients now, mostly in Queens and the Bronx, and will always do trans care if possible. When you think about it, trans healthcare is not extra or special care that only trans people need. It's actually treatments that everyone has access to, but are specifically denied to trans people. For example, postmenopausal women receive estrogens and progesterones for postmenopausal symptoms. Many of the services provided by reproductive endocrinology are often covered even by Medicaid. 19% of trans people refused care, any kind of medical care, due to transgender or gender non-conforming status. 28% experienced verbal harassment in medical settings. 2% of those people experienced being physically attacked while in the doctor's office. 50% of all trans patients had to explain trans care to their medical provider. Almost 41% of respondents reported attempting suicide, compared to 1.6% of the general population. Experiences of unemployment, low income, sexual and physical abuse in the home raise the risk for suicide attempts significantly. As a medical provider, I've seen many of my trans patients' lives improve once they've received trans-specific healthcare. And everyone is capable of that. Every medical provider is capable of doing even complicated trans care. If someone can do diabetes care or hypertension care, they can certainly provide hormones for a transgender patient. Join us in creating safe, accessible healthcare coverage for everyone.